Hi, I'm Jill Berger, Director of Employer and Purchaser Engagement here at the Leapfrog Group. It's a pleasure to be joined by Michelle Merchant, Hospital Network Relations at Horizon Blue Cross and Blue Shield of New Jersey. Horizon has been using Leapfrog survey data since 2006 and is one of our longest partners in using Leapfrog's value-based purchasing program. Michelle can show how their program is improving safety practices in hospital care for Horizon's members. So Michelle, welcome. Thank you for joining me today. You are one of the early adopters of using Leapfrog data for pay for performance. Can you talk about this and explain how it's been beneficial for you and for healthcare in New Jersey?
Thank you, Jill. As you mentioned, we've been on this road for a long time, partnering with Leapfrog since beginning in 2006. And without a doubt, it has been quite beneficial to the people of New Jersey in terms of their healthcare outcomes. We started on this journey with Leapfrog in order to provide incentives to our network hospitals for them to focus on improving care outcomes. And we identified Leapfrog as the partner because it was number one. It was a national survey that they offered. So that would be good for benchmarking. Hospitals were already engaged. And of course, purchasers were behind the Leapfrog effort.
What's really impressive is all but one hospital in New Jersey participates with the Leapfrog survey. And for a while, it was at 100%. How has this high participation impacted the quality of inpatient care in New Jersey and the marketplace?
From the beginning, our goal was always to get 100% of our network hospitals to complete the survey. And when we first started back in 2006, at the time, only 8 hospitals in New Jersey completed the survey. And so with the financial incentive that we offered, it helped play a part in getting the hospitals on board. And then we partnered with other stakeholders in the state, like the New Jersey Healthcare Quality Institute, which is the local organization that encourages the CEOs to complete the survey. And then word got out, and we would follow up, my team would follow up with hospitals who were not reporting. And so that's how we got there. And in 2019, we achieved 100%. And that was the first time I think we did. And we were so pleased by that. Then the pandemic came, and so that changed a little bit. But I think right now we just have one hospital that remains, and they have promised us that they will submit that survey before the deadline. So we're confident that we will continue to be at that level.
And so I know that one of the major domains of our survey that you're focusing on is maternity care. And you've seen some great improvements in hospital performance. Can you tell me more about the results?
Certainly, we're quite proud of what we've done with the maternity care. So as you may know, we were one of the early plan advocates working with Leapfrog on the advisory board to encourage the inclusion of maternity care domain metrics. And so we became very vested in the performance around maternity care because it is one of our top reason for a claim being submitted to the health plan. Almost every family that we insure have some sort of maternity claim. It's our number one claim. And so for that reason, we wanted to make sure it was safe. But then, more alarming was that New Jersey was an outlier among the states in terms of C-section rates, for example. There were hospitals where the majority of their deliveries were C-section. The expected rate is a little bit less than a quarter. And there were so many that had, a much higher rate, twice as as high as the national average. So we focused on that, but we weren't alone. You know, we partnered with the Department of Health and the New Jersey Hospital Association. We were part of a perinatal collaborative, and C-section rates was one of the early metrics that we looked at. We also introduced at Horizon a episode of care program as part of our value-based programs with our providers, and C-section rate was one of the metrics used in that program. And so with those efforts, you know, what they always say, what gets measured gets managed. And so we saw the improvements. And, you know, let me just share some of the things that we've seen with you.
That'd be great.
So in 2015, for example, there were only 10% of our hospitals that were performing at 0 to 20% C-section rate. That's the ideal number that we want. Only 10%. In 2015, when you looked at the hospitals that were 33% and higher, hospitals that were over 40% C-section rate, almost twice as much as the national average, we had 33% of those hospitals who were performing at that level. So a third of our hospital, that's not good for our population. We all know that C-sections are necessary at times, but the majority of a delivery at a hospital should not be C-sections. And so when you look at 2018, for example, for those hospitals where they had a greater than 40%, it was reduced to 18%. So they went from 33% down to 18%. When you look today at the overall performance in that domain, New Jersey surpasses the national average on those domains. So it's those efforts, that attention that were put on looking at those measures, providing educational programs for the hospitals, sharing best practices at some hospitals that were doing well, because, you know, we had from the beginning, some hospitals were performing well. And so we had them talk about the programs that got them there. For example, one hospital talked about their laborist program, where it helped to take the pressure from the obstetrician from his office hours to come to the hospital while a mother is in labor, and allow that mother to take the time that's needed.
That is amazing. How did you get the hospitals or encourage the hospitals to care about maternity care, for instance, to care about improving the C-section rates and prioritize transparency aside from payment?
So yes, payment went but so far. You know, it was
Right.
not a big part of the hospital spend. And when we stopped making payments actually in 2015. So for a good 10 years, we provided them with incentive, but it was a very small incentive. Of course, as you know, the national trend, and New Jersey is no different, has moved away from the solo community hospitals to more larger systems. So cumulatively, for some hospital systems, it was a lot of money, but overall, it's still, when you looked at their overall payments from Horizon, it wasn't a large number. But, you know, Leapfrog played a part of it. The New Jersey Hospital Association played a part of it. The release of the performance data got attention. And so increasingly, CEOs were being called upon at our hospitals to justify and defend and explain why they had such aberrant C-section rates. And so that was a good call to action. And then once we had already started the work, so the quality directors were already engaged and realized that, you know, it was a priority that they all shared, and that definitely helped.
That's great. You mentioned that you have educational programs that you put in place for the hospitals. Can you tell me more about that? In terms of teaching hospitals why the C-section rate why it's important for it to be lower. And I think what you did is you brought hospitals together periodically during the year. Is that right, for these educational programs?
That's exactly correct. So we usually get the reports from Leapfrog. The hospitals receive them sometime around February or March of each year. And shortly after that, I will convene a conference that we usually will host on our campus, and we invite all of our hospitals, and we have guest speakers, including in the past speakers from Leapfrog. And I look at the reports to see where overall New Jersey is not doing well, what domains are a priority for us that we need to focus on. And then I will identify hospitals whose report reflect very good performance, because I believe in peer education. Most of the quality directors are clinicians, they're nurses, and they have that background. They're used to peer education. And so I will invite a hospital that has shown and demonstrated success on a potential metric or domain to present, because usually they have a story, right? They've done something collaboratively, interdisciplinary at their facility, and they love to share that story. And we take that, we archive those, we continue to share them as new people join the quality departments at the hospital. We'll share those prior presentations. And we have experts sometimes, we've had perinatologists come and talk about the dangers of C-sections, especially if it were an early elective C-section, for example, and the impact to the mother and to the infant, and not just short-term impact, but long-term impact as well. So all of those were reasons why I felt it was necessary to drive improvement through education, and we still do that today. So in fact, we recently sent out the mid-year reports, and one of the hospitals looked very good, and they reached out to thank me for sending the report. And I said to them, this is the value-based report that we obtain, that we pay for on behalf of our hospitals in New Jersey. And so I said, yes, thank you for completing the survey. And I noticed that your performance was quite good. So tell me, what areas have you really worked on, that you have a story that you would like to share? Because I would be willing to have you present, at our upcoming session. So I look at their performance more so to recognize the high performers and to help those who are not as strong to get better. It's not punitive. It's about education and doing better, because we know that healthcare providers, they go in to really make a difference and to do well. And so that's where we meet them, with that belief and confidence that they want to do right for their patients.
That's great. It shows you the importance of transparency and the importance of sharing best practices, especially amongst peers. That is truly a success story. Michelle, what advice do you have for other plans that are interested in starting a pay-for-performance program and maybe tackling one domain to start with?
I am a strong believer in partnering between health plans and their providers. So, and hospital is a vital part of that partnership. And I do believe that the Leapfrog survey is a proven and effective method of doing that collaboration. And it's a plug in and play type of offering that Leapfrog provides, that hospitals and the health plans can do. I think it's worth it. I think when you have good outcomes and you do the right thing and patients benefit, it helps the bottom line. It helps the bottom line for the hospitals to attract patients, as well as staff. It helps the health plans to minimize costs of unnecessary care. The difference between a C-section and a vaginal delivery is very vast. And in some health plans, it's a very significant difference. And so you want to make sure that our members or the patients are receiving what's the best option for them. Not to say C-section is never right. That's definitely not the message, but that there is a time for everything, and we want to make sure that care is being done appropriately. I do believe that providing financial incentive makes a difference, especially at the beginning of a program, but it may not be necessary. I think increasingly hospitals and their executives recognize that better outcomes is better business. And so if there is not a way to give additional reimbursement, but maybe part of the overall increase that a hospital may receive in a given year using some of those metrics, and they can prioritize. I do believe that maternity care nationally is one that requires attention. And so I would definitely, advocate for that. We've seen the benefits in New Jersey, and our First Lady, Tammy Murphy, she has made maternity care outcomes a big part of her platform, and it has really galvanized an effort throughout the state. But there are other metrics,
Right.
I
Take
think
a look at your data.
yes, and I
See where
think
you're
CPOE,
from. Yeah.
yes.
And maternity is always a good place to start because it affects so many members, so many people.
Yes, every day, that's going to be, and it's major surgery when it's a C-section, and so
Right.
there are all types of issues associated with any type of major surgery. So yes, and it's a way of life, right? And more deliveries occur in the hospital setting. They're not occurring at home or birth centers. The majority are in the hospital setting. So since that's the option that most mothers make, then why not? Why not make their choice of that option be in their best interest? And so I think there's value in measuring.
That's right. I can't agree with you more. Michelle, thank you for speaking with me today and sharing Horizon's incredible efforts. The employers who founded Leapfrog value what Horizon has done and value Horizon for their excellence. Thank you for what you do and Horizon's commitment to the safety of your members and the community. I really appreciate it.
Thank you so much, Jill. It's really been a pleasure, and it's one of the most gratifying aspects of my career and tenure at Horizon to have been a part of this and leading this effort for all these years. And I will say that I think one of the unexpected things that came out of it is that it really solidified our credibility and our the way that we are viewed with our network hospitals in terms of being an early champion of improving performance, never taking a punitive approach, but one to reward and to recognize. And, that's a priceless benefit. And it's one that I believe will endure. And the partnership with Leapfrog has certainly made that very easy.
That's great. Thanks again, Michelle.
Sure thing. Have a great week.